Bismillah. Okay, so we have a recording today. Bismillahirrahmanirrahim. Today we are having obesity and pregnancy. Theory we are doing, theory part. Okay, this is their guideline. We are going to show it. So in the theory part, there's obesity and pregnancy. What we have to do. The points which is are important for the theory point of view is that when we are communicating, we will never communicate that you are a woman or that you are a fatty woman. So we will just communicate her in a sensitive and respectful manner. Okay, when we are talking to her. Then that one means we have to advise her to lose weight before pregnancy. At the time of the pregnancy, there is no way to reduce the weight. Okay, because baby has to, baby will be there, the food will be there, placenta will be there, so she has to increase the weight. So we don't never advise patient to reduce the weight during pregnancy. It has to be before pregnancy. Okay. She has to take a high dose of folic acid. Means high dose means 5 milligram. And obese women, they are deficient also in the vitamin D. So we have to start for her folic acid before pregnancy. Okay, sometime 3 months before pregnancy or a 1 month before pregnancy, we will start this folic acid 5 milligram and vitamin D. And then if she become pregnant at the first antenatal visit, we will do the BMI. BMI, we have to calculate her BMI, okay? And then we will make a record. And these women, when we are, they have a high risk of hypertension, these obese women. So when we are measuring her BP, the cuff is not, or it means normal cuff of the BP apparatus. It is not easy to measure the blood pressure. It will come wrong. So where we have to measure it, we have to measure at mid-arm circumference. This is the where we will put our cuff of the blood pressure equipment. Okay. And if her MAC means mid-arm circumference is more than 33 centimeter, then we have to use larger cuff for blood pressure measurement. She has to have a blood pressure measurement every visit along with the routine in the urine. And this is the routine in the clinics. And if her BMI is more than, it's nearly 29.9 kg square meter, or we can make it 30. If our BMI is 30, then we have to do the oral glucose test screening, because you know this obese women, they have a higher risk of insulin resistance, and this insulin resistance will make them the gestational diabetic if she is pregnant. So we have to, she has to do the screening with the glucose tolerance test. Okay, this is the one she has to do. And another thing is that this is the one thing. And another thing that they have a high risk of cesarean section. Means they can deliver normally, but they have a high risk when they are in labor to deliver by the cesarean section. So she is obese woman. She is going to have a high risk of the infection of that area, the wound. So she has to receive antibiotic prophylaxis. Okay, antibiotic prophylaxis and thromboprophylaxis. She has an increased risk of DVT. Okay, so this we have to calculate her according to height weight ratio, according to the weight. The thromboprophylaxis we calculate with weight, maternal weight, at the time of the booking. Okay, first booking visit, and not BMI. This is we have to remember, and not BMI when we are calculating this thermoprophylaxis dosage. So we have to calculate with weight, maternal weight, not BMI. So this is a very important MCQ question. Okay, and these women, they have to be seen with BMI 35 or 40. They have to be seen in the antenatal clinic with the anesthetic. Anesthetic is going to make the plan for her if she will come in the labor or if she is for elective case. So it has to be seen in the anesthetologist in the clinic. And then what he is telling that we have to teach her that, because you know these women need to be have a IVSS, IV cannula early in the labor. We will put them to call the anesthetics. Okay, to these women. And then other thing what we have to do, she need extra support, one-to-one midwifery care, and regarding to the fetal monitoring, she need the monitoring with the fetal scale because with the high body mass, means tummy, it's not possible to the tummy to get her CTG recording easily. So she needs to be done by the fetal scale electrode. So we use that one for this thing, and then fetal scalp electrodes. We need it for that CTG. Okay. And then another thing said at that one during labor when she will come it. This is according to the plan between the place of the birth and where she has to be delivered. This is consultant decision and with the patient individualized this week. And if she is having a previous cesarean section where she has to. So, and this thing we have to do. And then the most important thing, she has to attend the breastfeeding classes. Because when the specialist, she has to be seen, breastfeeding specialist, she has to be seen during pregnancy or before she will discharge at home if she delivers, if she has no counseling in diabetes. So because most of them they don't breastfeed to the baby because this obesity is hampering her ability to breastfeed the baby. They are the ones who's going to teach her how to do the breastfeeding. And then the most important thing, if she don't have a medical or obstetrical contraindication, she can do the exercise in the pregnancy and after pregnancy. Only 10-15 minute exercises, and mostly the exercises they are recommending is the walking exercises. They recommend. That's the best one they do. And then this is the most 10 important points in the this means obesity in pregnancy. You have to remember. Clear, Dr. Surya? Okay. So the thing is,
Yes, yes, it's clear.
in the group, I have written it about the obesity risk rate in the Ireland. Okay, because this is Irish exam we are going to give it. So obesity BMI is increasing. Obesity is increasing in Ireland. Okay, and if it is increasing, it means how much it is increasing. They don't have a data. All the data is not available to them, but the whatever the according to their guideline, which whatever data is available at that time, the obesity, they are 25% women are found to be obese at the first antenatal visit. This is the thing they are telling in this guideline that 25% women will come antenatal visit. When they are coming antenatally, that means 100 patient women come, 100 women. In these 100 women, 25% are, or 25 women are obese at their first antenatal visit. So we have to check them and we have to make a counseling with them. What are the complications she can have at the obesity, or complication for the baby and complication for the baby, for the mother? This is very important, okay, for the exam point of view. So what she has to have, she has an increased risk in pregnancy complication like diabetes, preeclampsia, congenital malformation, and fetal growth abnormalities. What fetal growth abnormalities she can have? She can have a macrosomic baby and she can have IUGR baby. So both can happen. So don't think that if she is a fatty lady, she cannot have a IUGR baby. She can have. Please remember this thing. She can have bloating. And she has an increased risk of obstetrical intervention like cesarean section. And forced delivery is very less, but most of the deliveries they will go for the cesarean section. And these are the long-term effect. If you may consider maternal obesity, what will have it on diabetes? She can have a herself. I'm talking about the patient. She can have a cardiovascular risk factors, and she can have a diabetes. It can be a diabetic, not type 2 diabetes. It can be covered. These are the, and she can increase risk of childhood obesity for her, of her offspring. Okay, these are the facts. And if we will consider for the baby, what the baby can have. Most important complication for the baby is the neonatal problems. congenital heart diseases for the baby. And baby can have a IUGL, baby can have a macrosomia, baby can have a shoulder dystrophy and increased risk of a cesarean section. So these are the problems the baby can have. I will, inshallah, we are going to put this thing to the YouTube. So you can get from there. Okay. So they are saying that most of if we will same at the report of them, this is the class 3 obesity is the most problematic problem. They are the one, most of them, they are dying. Class 3 and class 4 obesity, risk is less, but class 3 and class 4, they have a risk of uh, uh, death, okay, morbidity, which we call it morbidity, okay. So they can have a morbidity risk. Okay, this we finish it. Yeah. And the most important thing is their pre-pregnancy. I already told what we have to do. Okay, what's needed for the pre-pregnancy. Dr. Sidra, how are you? Okay. So this is the most important question which we have to know how to calculate the BMI. Okay, calculation of the BMI. This is the one we have to know the formula. I will this BMI to be calculated in the first trimester. And the formula we have to put about this formula height weight ratio into this one. Okay. I will put in the and you can make from there and learn by heart that formula from the exam. Okay. So when she has to have a BMI to be calculated, exam MCQ first visit. Okay, first antenatal visit she has to have her BMI. Okay, ji, this we finish it. So now what are the complications of the baby? Fetus can have a spontaneous miscarriage risk is increased. This is the one point. Okay, we have done it. And then what we have it, otherwise, for this we have to use the TBS. TBS is the best which we get from her. So how we will follow her antenatally? Antenatally, she needs, because you know, this pubis symphysis height we cannot measure because she is very obese. Her tummy is very fatty. How we will measure it with the tape? So she needs a serial ultrasound for the growth of the baby. Means I told you na, she has a growth of the baby restriction to the IUGR baby and it can be a macrosomic baby. So for this we need to have a ultrasound assessment. She need to be able to the TBS is the best in the first trimester to date the pregnancy and this one, but she needs to be able ultrasound. So if for abdomen or TBS, whatever the method patient is allowed to it, needs with the specialist for the growth of the baby. We need that one antenatally. Okay. So we already finished this thing and we already finished at 24 to 28 week. We have the oral glucose tolerance test. I'm talking about antenatally. Every visit we have to check about her blood pressure, okay, and the protein. This is the most important point which she needs to have a anatomical scan. The problem is that in these women, the anatomical scan is very hard to normal doctors. Or she has to be seen by a specialist, or they are mostly they will refer her to the if she is class 3 and class 4 capacity. So she has to be referred to the fetal medicine unit because they are a specialist about the abnormalities, anatomical scan, which we call it anomaly scan at in 16 to 22 weeks, which we are doing. Okay. So this is very important one. And then she has to be seen by the dietitian to be the pregnancy for her diet. Okay. It's fatty liver, no? Because we are not supposed to be like her to increase her weight. So this is another thing we have. I already told you that she needs to be have a vitamin D. And vitamin D, how much she has to take it? She has to take it 10 microgram. Please remember this thing. 10 microgram is equal to 4,000 international unit. Okay, during pregnancy and the breastfeeding. This is another point which we have it. Exercise, I already told you, 15 to 30-minute exercise, mostly the walking exercise, the swimming and this thing she cannot do. So mostly exercise is the best exercise she can do, the walking exercise. if she don't have any contraindication for the exercise. And I told you that she is having an increased risk of complications. Means I told you cesarean and cesarean after cesarean, she has an increased risk of wound infection. She needs to be by antibiotic. And then I already told you that infection and this when post okay now we finished this thing. So delivery I already told you. She has to have a delivery in the consultant led hospital mostly. But and the most important one if she is from the way back. And if she is a multigravida and if she is less than 30 BMI, then she can have other areas which she can deliver. But after 30, she has to be in a hospital, at the hospital, unfortunately. Okay, so this we done it. She has a more risk of hypertension. I already told you what we have to do. So this is the whole thing which we have to add it. And this thromboprofile assessment, when she will deliver, we have to, after delivery, she needs what? She needs to have a breastfeeding to be seen, and she has to be assisted for the thromboprofile and she has to have a follow-up appointment. These are the important things which is important for your tourist, which I do. Okay, clear? Clear, Dr. Sidra? Hello, Dr. Sidra. Can you hear me, Dr. Sidra?
Yes, ma'am.
Okay. Okay, Dr. Suraya, it is we finish it. So I will just let it to be stop for 2 minutes, and then we will start to make what we call it. I'm just pausing it. Okay, I will pause the recording. Yeah. So now we are going to do the multiple choice question of this or a single best answer for the obesity in pregnancy. See, these are the my this obesity in pregnancy multiple choice question. See, if you will see from here, I just try to make it that complication just in a quick way. Quick way means gestational diabetic, preeclampsia, spontaneous abortion. So please remember, mostly this obesity they have a spontaneous abortion. Okay. This is the increased risk. She can have increased risk of preterm labor and the cesarean section. This is a quick way. Okay, and this is the one I share it there. This paragraph, please learn it by heart. This is very important. This paragraph means this column or algorithm which we call it. So please remember that one. So I will, if it is you cannot get from here, I will. I already put on the group. Mostly my things are there, so you can take from that group. Okay, so it will be very easy to solve the question. This one is also the one. The race which is I'm telling you, prenatal race, maternal race, and offspring race. So please, whatever I told you, it is there in that one. This is my habit. Mostly I do that one. This is called flashcard. So I make the flashcard. And for my paid course, this is the way I'm teaching. Okay. If you understand well and good. Okay. Dr. Surya, can you read it, please? And then we can try quickly before it will.
Yeah, obesity in pregnancy increases risk of which of the following in the baby? And A is autism spectrum disorder, intrauterine growth restriction, macrosomy, type 1 diabetes in childhood. E is childhood cancer. So it looks like macrosomy.
Right.
Oh, no, sorry, intrauterine growth restriction.
No. This all this here. You remember I told you. So please, what we will do? We will take one by one. Okay, we will solve the question.
Okay, okay.
They are increased autism spectrum disorder. And this autistic babies, mostly obesity. This is the main problem. Also nowadays they are getting it because autism there is no cause. They cannot find out the cause of autism baby. But this obese woman, they have an increased risk of autistic baby because my this MCQ which I'm making it the one which is I'm telling you I will make with them and some new things I will add it which I cannot I did not add
Okay.
at the time of when I'm teaching. So some new things
Mm.
added. So this will be in the means in the MCQs or single best answer which we call it SAB. Okay, SBA.
Yeah.
So they have an increased risk of autism. They have an increased risk of, I told you, na, they can have
Growth restriction.
I told you
IUGR.
it is so big. And this is the thing, it is that this is, I did not type with diabetes in childhood. In childhood is different. Okay. So
Yeah.
D is false. A is false. They
Yeah.
cannot have a
E-
cancer. They don't have a diabetes. Okay.
Yeah. Yeah.
Yeah.
Okay.
Yeah. So
So we
this,
have to do like that. True and false type. Yeah.
okay. So the answer is in front of you.
Yeah.
Okay. This is the explanation. Okay,
Yeah.
this is the explanation. Explanation, you want to read it? Maybe if we can do it one or two at least.
Yeah.
Can you read the explanation, please?
Recent evidence suggested that maternal obesity increases the risk of autism spectrum disorder in children. Maternal obesity increases the risk of intrauterine growth restriction as well as the risk of the microsomy baby. There is no recognized link with the type 1 diabetes or a cancer in childhood. Yeah, got it.
The
Yeah.
Can you please read the second one?
Which of the following statements is or are true in relation to obesity and pregnancy? A is the risk of primary cesarean sections is higher. The success rate of VBAC is lower in obese women. The recommended carbohydrate intake is 45% to 65% of total energy in obese women in pregnancy. Weight reduction is recommended in obese pregnant women. E is obesity increases the risk of vitamin D deficiency. So the risk of A is true.
B,
Yeah, and the success rate of is lower. Yes, true. The recommended carbohydrate, I'm not sure.
but it is true.
Uh,
This is
True. Okay.
nutrition. This is which I,
Yeah.
that's why I make it from here. So it will be easy for you people to remember it that it is 45%, 65% of the total energy
Okay.
today.
Mhm.
And they,
And weight reduction recommended in obese pregnant. No, we have to tell them before pregnancy to weight reduction.
this is the benefit I'm
Obesity,
telling you the
false.
these guidelines,
Yeah.
not guidelines. Sometimes I don't take the things are in the guideline. Okay. So
Yeah.
when I'm telling you, so the things are there. If you attend the
Yeah,
things,
it makes easy.
you
Yeah.
understand me.
And yes, got it. Obesity increases the risk of vitamin D deficiency. Yes, it's true.
So you see the answer in front of
Yeah, now I see the answer. Yes.
you. Okay.
So, studies shows that maternal obesity increases the risk of cesarean sections and also reduce the success of vaginal delivery after cesarean section. Maternal obesity increases the risk of vitamin D deficiency, starvation, or weight reduction. Is not recommended in obese women in pregnancy. The recommended carbohydrate intake 45% to 65% of total energy in obese women in pregnancy.
We have only 2 minutes. So in 2 minutes, we will not do the explanation. At least we will do this question. Can you read it? Question number 3.
Yeah. Which statements states true regarding the medication given in pregnancy? Yeah, metformin is recommended in non-diabetic obese pregnant women. Low dose aspirin is recommended in all obese pregnant women. Low dose aspirin is recommended in all these pregnant women with a preeclamptic risk factor. Folic acid 5 milligram is recommended in obese women. Vitamin D is recommended in obese pregnant women. So number A is false. We don't recommend metformin. And low dose aspirin recommended in all obese patients. I don't think it's true. B.
Low dose aspirin is recommended in all obese women, not all obese women.
Not all, yes. Yeah, that's me. So low dose aspirin is
Here B.
recommended in all
Yes. Okay.
pre
C.
in with preeclampsia. Yes, that's true.
Yes. She has a
And
reason.
folic acid, you said, yeah, we have to give 5 milligram. And vitamin D recommended. Yes, that's also true. Oh yeah, answer is down. Yeah, okay.
So
Got
3, 4, and then we will finish it.
yeah.
There is only one
Yeah,
more.
with regards to obesity, which of the following statement is true? The epidemic mainly affects development countries. The worldwide incidence had tripled since the 1980s. There are non-obese women compared to the obese men. Uh, BMI more than 40 is required as a moderate obese. So less than half of the pregnant women who died in UK from direct or indirect cause are obese in the 2003 to 5 terminal report of confidential inquiries into the maternal deaths.
Just only read the answer because it's going to be finished now.
Oh, A is a false, B is false, C is true, D is true, E is false.
This is the thing we finish it, Shukran, Alhamdulillah. And then I will try to put in the YouTube, and in the YouTube, I will share with you people the link. Okay?
Yeah, thank you.
Okay, thank you,
It's
my
okay. Thank you so much, Lisa. Dr. Lisa, thank you.
I hope, inshallah, the most important thing, please write something.